By the end of this video, I'd like you to be able to explain a big picture concept of CT, use correct words to describe black, white, and gray on CT, and define window and level in the context of radiology. In addition, I want you to understand the basics of when to use IV and oral contrast. Pause the video and try to explain how a CT works as if you were talking to a medical student. I think of CT in simple terms. A CT is just an X-ray tube that spins around the patient in a helix. The data from the CT is in density, or Hounsfield units. So a CT is a map of density differences within the body. IV contrast augments the density differences in the body in relation to blood flow. Once we have a map of CT data, we display it on a grayscale. Hypodense, or hypoattenuating, describes low density or dark. Hyperdense or hyperattenuating describes high density or bright. Each voxel is given a density value in Hounsfield units, with 0 being water and minus 1,000 being air by definition. Everything else fits within this framework. If you think of water as your anchor point, ask yourself, is this more dense or less dense than water? For example, fat is less dense than water, so it'll be darker, and bone is more dense than water, so it'll be brighter. However, the human eye can differentiate a finite grayscale, so we have to display that density information in a way that is useful. This is where window and level come in. Window changes the limit points, above and below which all densities are white and black, respectively. Level changes the midpoint of that range. Let's look at an abstract example. During this image, focus on what is within the blue outline. This is a test pattern of different densities, with 0 being hypodense and 100% being hyperdense. The window and level are displayed on the bottom. As a side note, the two 50% boxes are in fact the same densities despite sometimes looking different. This is an illusion. Initially, the window is narrow, so everything on either side of the center is either black or white. As we widen the window, the differences in density in the middle of that range becomes more visually apparent. As we continue to widen the window, we can distinguish more densities in the range, but the density differences between each adjacent density is less apparent. For this image, focus on the blue outline. The number for the level is not the same as you will see in CT, but the concept is the same. As we start with a dark level, we can see the most dense boxes only, and below a certain point, everything is black. As we make the level brighter, we are able to distinguish different parts of the curve, but because the window stays the same, the number of boxes we see does not change. That is, we can only see 5 gray boxes between black and white. Here are examples of how we use window and level to our advantage. A liver window is narrow because all the densities in that liver are similar. Bile is near water, or 0. Blood is around 40 or 50 Hounsfield units, and hepatocytes are in between. So we need to compress that grayscale between a narrow range so we can see the density differences between them. On the other end of the spectrum, lung windows are wide because we are interested in everything from air, minus 1,000, to blood vessels, positive 40, to calcium in coronaries or lymph nodes, positive 400. Soft tissues are in between. Bone is also a wide window, but a different level because we want to see a wide range around a different center point. Here are the same coronal images of a CT chest, abdomen, pelvis with contrast in various different window presets. Liver window, we can clearly see the differences between hepatocytes and the vessels, but fat and air look the same, and bone and contrast look the same. Soft tissue windows show the definition in the liver less clearly, but we can differentiate fat and air. Lung windows allow us to see more detail into the lung, but lose definition in the abdomen. Notice how the bones are to your right. With bone windows widening the window and darkening the level, we see the bone detail much better. Remember, CT data is density. If you know that concept, you can work your way through much of a CT. Most pathology will be associated with some amount of edema or water, so with each organ, you can ask yourself, if I add water density to this, will it get brighter or darker? Most pathology will also have some inflammation or increased blood flow. Iodinated contrast will augment density differences based on blood flow, which the term contrast enhancement describes. To put it more simply, the pathology can really change two aspects of a CT, the morphology and the grayscale. Tissue density and blood flow will both affect the grayscale. If you have a good understanding of anatomy and pathophysiology, you can work your way through CT interpretation without too much memorizing. Here's an example in a trauma patient. Axial and two coronal images of a CT chest, abdomen, pelvis with contrast. First, notice the hypodensity in the liver. In a trauma patient, this is a laceration. Think about how a trauma will add inflammation and edema to the liver. Next, look at the coronal. Compare the density of the right versus the left perinephric fat. The right is much denser than the left due to blood from a renal laceration. Also note the fluid around the liver. The same image, but in lung windows, shows abnormal increased density in the lung, which is a pulmonary laceration. Moving on to protocols. When do you choose IV contrast or no contrast? Generally, the CT abdomen and pelvis with IV contrast will be the main study. Non-contrast studies are helpful for a few scenarios: acute hematomas, renal stones, or ethydal deposition after TACE procedures. This example demonstrates the value of contrast, enhancing density differences in relation to blood flow. Axial CT images without and with contrast. The contrast image on the left shows the hepatocellular carcinoma invading the portal vein, a finding that is all but impossible to see without contrast. Multiphase exams are used to characterize a known or suspected specific lesion. This example is a renal mass. Different patterns of enhancement can distinguish tumors on imaging. Moving on to oral contrast. Positive contrast will increase the density of the bowel lumen. While both Omnipaque and Gastrogastrin or GastroView are positive contrast agents, Omnipaque is isoosmolar and the Gastrografin is hyperosmolar. Positive contrast is used for intra-abdominal abscesses, complex bowel surgeries, non-contrast CTs to help show the bowel better, or bowel obstructions, although it is not always necessary for bowel obstruction. It is not needed for acute abdominal pain or in trauma. Neutral contrast will have density of water. Water is the most commonly used at OHSU. Volumin is another neutral contrast agent that is not absorbed. Here is my search pattern. This is one of many approaches. It is important to build this to your liking and do it the same way every time. A structured approach will help you prevent missing any finding. For the chest, I start at the neck, look through the mediastinum, down through the heart, look through the great vessels, switch to lung windows, look at the airway, look through one lung, look at the other lung, and look at both in conjunction. Look at the soft tissues, and then the bones. For the abdomen, I start off in a narrow liver window, look through there, go to the gallbladder, look through the gallbladder, look through the common bile duct into the pancreatic head, go from the pancreas, look at the pancreas through to the spleen, look at one adrenal and then the other, look at one kidney and then the other, follow the ureters down as best I can to look at the bladder and the reproductive organs. From here, I follow the colon retrograde through the sigmoid colon, transverse colon, ascending colon to the ileocecal valve and the appendix. I look at the small bowel in total, the stomach, and the GE junction. I then take another look at the peritoneum, looking for free fluid in the pelvis, followed by the vessels, the bones, and the surrounding soft tissue. As you are looking through body CTs, your anatomy knowledge will improve. One good starting point is to remember which organs are retroperitoneal. Here is a list and a mnemonic of the retroperitoneal organs and arrows showing where they are in this CT peritoneogram. Thanks for listening. Email me anytime with questions.